Welcome to Axon Integrative Health. I'm Dr. Hannah Wadsworth.
And I'm Dr. Brad DeBeer, and we are the co-owners and the co-founders of Axon. We have both had our own struggles in our healthcare, and along the way, traditional medicine has just left us with either more questions or lack of solutions. We saw a need for change, which is why we created Axon, to help change the paradigm of healthcare and deliver care comprehensively to each and every patient that needs it.
Here at Axon, we offer a wide array of specialties ranging from functional neurology, functional medicine, chiropractic, acupuncture,
physical medicine, regenerative medicine, things like neurofeedback, hyperbaric oxygen, IV care, and many others. How we help is really just applying these things into each category of brain, body, and mind.
All of these specialties are aimed at regulating the nervous system, balancing the body,
which includes regulating blood flow, balancing out hormones, promoting good gut health.
This also includes stimulating the brain, promoting good positive mindsets,
thoughts, behaviors surrounding some of the issues that you're dealing with, and how these will progress into feeling whole again. With that, we see a large set of various populations and patient populations ranging from concussions, TBIs, spinal cord injuries, ADHD, to things like MS and Parkinson's.
We also see patients with strokes, MCAS, POTS, SIRS, histamine intolerance, chronic inflammation, fatigue,
things like SIBO, gut dysregulation, irritability, mood swings, anxiety, depression, PTSD,
hypermobility,
joint issues, orthopedic pains, sports injuries like MCL tears or ACL tears, ankle sprains, bicep issues, shoulder issues, low back pain.
Also any neurodegenerative diseases.
We also see quite a bit of dementia, functional neurological disorder, CRPS or complex regional pain syndrome,
mold toxicity, Lyme.
We see a lot of other chronic pain issues and how the brain and the body interact to create these issues. So how do we achieve all this? How do we see so many patients, various populations, and still have great success with each and every one of them? We focus on three main principles of care: promoting cellular health, modulating and altering inflammation, stimulating neuroplasticity, or how the brain changes based on the environment and the stimuli that you expose it to. We can apply those three principles to any patient that's sitting in front of us. Each and every patient, regardless of what you're dealing with, is treated as a sole person. We treat you, and how this is affecting you, and how you want to get back to your life, and how we're going to achieve that looks different for each person. Due to that, we don't have a blanket cost, we don't have a blanket protocol for each and every condition, because we build it for you. And each cost changes based on what we think you might need, what your schedule looks like, what your finances look like. We take all these into account because what might be really good on paper but doesn't work for your schedule suddenly isn't good anymore. So we need to find a plan, develop a plan together that fits how you want to heal and your healing journey and your timeline associated.
With that being said, we don't accept insurance directly. We want to be able to treat you for what you have going on, not for what insurance dictates and what insurance will cover. We provide super bills at the end of care so that way you can get reimbursed from insurance.
We do, however, work with car insurances and workman's comp. So we see motor vehicle accidents through personal injury. If you're working with a lawyer, or if not, we have people that we work with that we can point you towards. So if you're looking to become a patient, we start with a free discovery call. This is to help answer questions about the clinic, about ourselves, about the team that we have, so you can get a better understanding of how we can help you. This isn't intended for medical advice. So if you have a question based on what I should be doing, or if I do this, then this happens, how should I fix that? We can't answer those questions on that call, but we can suggest, hey, this does sound like something that we can help. Let's go ahead and schedule an initial evaluation. And that's our first in-clinic eval, and that can be either a 30-minute problem focus, 1 hour basic evaluation, or that could be a 2-hour comprehensive evaluation. Third step here is diagnostics. So from that evaluation, we determine particular diagnostics or some further insights of measurements, either computerized balance or eye movements or metabolic analysis or a brain map, or blood work or specialty testing, whatever it might be. That'll be done on the third visit on our schedule. From there, we have a diagnostic review and integration phase. So we talk about what all of these testings meant, how this pertains to you, and what we're going to do in the treatment plan based on these findings. The fourth day is when we start care and we start moving forward on that treatment plan. Every 10 sessions, we reevaluate, we redo those diagnostics, we sit down and have another reevaluation meeting and consult and talk about the progress. That way we can stay on top of this progress and adjust as needed. If you're getting better, the treatment plan should be getting better too. If you're not getting better, well, then we need to change the treatment plan too. So we do this every 10 visits, regardless of how long you're going to be with us. We call these phases of care. These phases of care usually progress and lateralize and adjust based on your improvements, and finally until we kick you out the door and you don't need us anymore.
So we have 5 basic lifestyle guidelines that we give to each of our patients. This is something you can start anytime. You don't have to be an active patient here. You can start this before you even come in to see us. These 5 things are nutrition, sleep, exercise, breath work, and community. All of those things are very important to not only your nervous system as a whole, they're also very important components to your well-being and to your health progress in general. And those 5 things are things we preach on the entire time you're in here. That way you're helping yourself while you're outside of the clinic.
We have a funny saying in here. I don't know how the dentist did it, but brushing your teeth is something that is known by almost every human to be done in the mornings and the evenings. Don't discount the brushing of your brain, your body, and your mind as well. Just because you did something this morning to help your health doesn't mean that you don't need to do something in the evening as well. So if all that resonated with you, if you feel like you want to start feeling better and seeing the change and seeing the results in your health that you want to see, give us a call, book out a free discovery call, or just go ahead and get scheduled for the initial consult, and we'll be able to help you create a plan and a journey to achieve your goals. See you soon, and happy healing.